Which level of prevention aims to prevent the occurrence of disease? The answer is C. Primary prevention. The Alma Ata Declaration on Primary Healthcare was adopted in which year? The answer is B. 1978. Which of the following is not an element of primary healthcare? The answer is C. Cosmetic surgery. The incubation period of measles is approximately. The answer is B. 7 to 14 days. Which vaccine is given at birth under the National Immunization Schedule? The answer is C. BCG. Full form of ORS is. The answer is A. The headquarters of the World Health Organization is located in. The answer is B. Geneva. Which vitamin deficiency causes night blindness? Answer is C. Vitamin A. The first contact point between the community and the health system is. The answer is C. Primary health center. The causative organism of tuberculosis is. Answer is B. Mycobacterium tuberculosis. Which of the following is a vector-borne disease? The answer is B. Malaria. The causative organism of malaria is. The answer is C. Protozoa. Plasmodium. Which mosquito transmits dengue fever? The answer is C. Aedes aegypti mosquito. The normal chlorination level of drinking water at the consumer end is approximately. The answer is B. 0.5 mg per liter. Which indicator is commonly used to assess the nutritional status of children under 5 years? The answer is C. Mid-upper circumference. Which vitamin is administered to newborns soon after birth to help prevent bleeding due to vitamin K deficiency? The answer is D. Vitamin K. Which of the following is considered the safest method for disposal of infectious biomedical waste? The answer is C. Incineration. Which disease is prevented by the BCG vaccine? The answer is B. Tuberculosis. The purpose of a home visit by a community health nurse is to. The answer is B. Assess family health needs, provide care, education, and follow-up. Which of the following is an example of secondary prevention? The answer is C. Early diagnosis and prompt treatment. Epidemiology is the study of. The answer is B. Distribution and determinant of health-related events in population. Which measures describes the number of new cases of a disease occurring in a population during a specific period? The answer is B. Incidence. Infant mortality rate is the number of deaths of infants under 1 year of age per. The answer is B. 1000 live births. Which national program is primarily aimed at the prevention and control of tuberculosis? The answer is B. National TB Elimination Program. Which of the following is the best method to prevent iron deficiency anemia in pregnant women? The answer is B. iron and folic acid supplementation. The first milk secreted after the childbirth rich in antibodies is called. The answer is C. Colostrum. Exclusive breastfeeding is recommended for the first. The answer is C. 6 months. Which contraceptive method provides protection against sexually transmitted infections? The answer is C. Male condom. The main objective of the National Immunization Program is to. The answer is B. Reduce vaccine preventable disease through immunization. Which health worker serves as the first point of contact between the community and the public health system in a village? The answer is B. ASHA. The ideal residual chlorine level in the drinking water after 30 minutes of contact is. The answer is B. 0.5 milligram per liter. Which of the following is considered a safe source of drinking water? The answer is C. Protected deep bore well. Which disease is commonly associated with contaminated drinking water? The answer is B. Cholera. Which vitamin deficiency causes scurvy? The answer is C. Vitamin C. The best method of disposal of human excreta in rural area is. The answer is C. Sanitary latrine. Which color code biomedical waste bag is used for human anatomical waste according to the biomedical waste management? The answer is B. Yellow bag. Protein energy malnutrition in children commonly includes. The answer is B. Kwashiorkor and marasmus. Which nutrient is the main source of energy for that body? The answer is C. Carbohydrates. The most effective method to prevent mosquito breeding is. The answer is B. Eliminating stagnant water. The major source of iodine in the diet is. The answer is A. Common salt fortified with iodine. The full form of NHM is. The answer is A. National Health Mission. The National Health Mission was launched in which year? The answer is B. 2005. The accredited social health activities is selected from. The answer is B. Community or local village. Which vaccine is administered to protect against tuberculosis? The answer is B. BCG. Under the Universal Immunization Program, the zero dose of OPV is given. The answer is A. At birth. Which vitamin is routinely supplemented to children under the vitamin A prophylaxis program to prevent nutritional blindness? The answer is C. Vitamin A. Which of the following is the best indicator of maternal health service? The answer is B. Maternal mortality ratio. Antenatal mothers should have a minimum of 4 antenatal checkups according to the traditional focused ANC model. Is true or false? Answer is A. It's true. the normal duration of pregnancy is? The answer is C, 40 weeks. Which contraceptive method provides long-term reversible contraception? The answer is B, copper T. Tuberculosis is primarily transmitted through? The answer is C, airborne droplet nuclei. The causative organism of leprosy is? The answer is B, Mycobacterium leprae. Which mosquito transmits malaria? The answer is C, virus. The incubation period of rabies is usually? Answer is B, 1 to 3 months. Which disease is commonly known as Kala Azar? The answer is C, visceral leishmaniasis. HIV mainly attacks which cell of the immune system? The answer is C, CD4 lymphocytes. Which hepatitis virus is mainly transmitted through contaminated food and water? The answer is A, hepatitis A. Which vaccine is recommended for prevention of hepatitis B? The answer is B, hepatitis B vaccine. Which of the following is the most effective method to prevent HIV transmission? The answer is B,